Hi there. This video is a demonstration of how you would use our systems for medication reviews. For this demo, I've set this test patient up to be a largely compliant and helpful patient who's had their annual review, had their bloods done, and completed their questionnaire. Now, it may be then that on retrieving the record, you see a pop-up like this. Patient needs notes-based med review following completion of the questionnaire. If suitable, extend the review dates. So I could skip straight to recording a notes-based review. I could go to the repeats list, but what I'm going to launch instead is the prescribing overview. If you haven't got this pop-up and you want to launch our prescribing overview template, it's this white and red pill icon up here under the demographics. Now, the idea of this template is to give you the information you need, as I say, a GP or pharmacist, to review this patient's medication. And I just want to talk you through how this works and what your options are at this point. First of all, at the top here, we can see that they're awaiting clinician review, i.e. they're in this list for me to review. Their annual review status is up to date, but they have got some monitoring tests due. Now, it might seem like a little bit of a contradiction that you've got here bloods obs for med monitoring up to date and monitoring tests due. The reason for that is our system delineates between tests that are essential for safe prescribing and tests that might be needed for other reasons. The reason we do that, say a patient doesn't bring in their urine ACR, or in this instance, this patient's not had an ECG that would be normally linked to their hypertension diagnosis. In this particular instance, that's not a reason we want to block all the kind of med review processes. If you want the system to work differently for your practice, we can change that. But most practices find this slightly more pragmatic approach is best. We can see here which reviews have been completed in this QOF year. We can see the medication that's monitored. And the fact that we've got this nice green tick up here assures me that essentially this monitoring has been done. We've then got some prescribing suggestions. Some of these are very high-risk things that you absolutely would not want to ignore. I don't know, patient who's UK MEC4 on combined hormonal contraception, or I don't know, on a medication that should be stopped for some reason. Others are a lot softer like this. So self-medicating, ibuprofen, and no gastroprotection. So this self-medicating has been picked up from this med review questionnaire. I can see the answers here. Are you regularly taking any medication that's not prescribed? Yes, ibuprofen. Provide details, odd days with aches and pains, i.e. probably not a concern for this patient, age 39, to be putting them on gastroprotection, but flagged there for review. If you've got Ardens, you might also see anything that they've picked up as well. We can see the answers here. If I keep going down, I can see what they've got on repeat. I can also see here, look, any meds that need to be stopped, add cal. So I think I can do that from here. Yeah, looks like a patient request, so I will stop that one. I can see things like when a med review was last coded, which was never, because this is a test patient. I can see their recent results and so on. So as much as possible, we're trying to build this in a way that means you don't need to come out of this screen to review the medication. Now, most of the time, we would hope the outcome is this record a notes-based med review on saving the template, i.e., you've got the information there that you need to complete the review. If, however, there's some reason that makes you think, no, I want this patient to have an appointment, instead, you can pick one of these two options. So under needs appointment, you've got structured med review, or a kind of longer appointment, or a med discussion, shorter appointment. Not all practices are breaking them down that way in terms of how things get booked, but it can be useful and many are. The idea for med discussion is more so there's one particular medication. So say, for example, I don't know, discuss PPI and ibuprofen, something like that, where it might be something that's been picked up in the system. And if I did that, when I okayed the template, it would ask me if I want to send an invite. And these notes here would appear on this screen. So the idea is when the patient then attends, the pharmacist can see what I've put. They'll also get follow-up invites if they don't engage. If your practice has got it configured, it would prompt staff for that to happen, and so on and so forth. There are also some other options if particular things have been reviewed or considered, like, say, statin changes or particular medications have been reviewed as part of this general med review. Some of these as well, our systems might flag up. So if, for example, patients completed a HRT questionnaire recently and that hasn't been reviewed and you code the med review, the system would ask you, have you done that as part of this med review? And again, it will explain what's needed there. So for this one, we'll clear that one off and we'll do the notes-based med review. The reason we're doing this on saving the template is simply because the protocol works much, much quicker when you launch it as the template is saved. Previously, we used to do it within the template and it was really slow and painful. Last thing before I OK this, there are lots of useful links here. You can pop out repeat templates, other medication sensitivities and allergies. You've got some of the useful links to some of the great Arden stuff or online resources that you might want to use. But most of the time, hopefully, it's fairly straightforward. So let's click OK. In the background, when I do that, there we go. It's going to do a few more checks. It's checked compliance. And as I'll show you in a moment, it's going to document it, what exactly has been done and checked in the notes. Do I want to inform the patient? Yes, send automatically, as if you're kind of used to the message and you're happy with it. You could put review medication. Some practices choose to use this as an opportunity to add on any particular things. There might be scenarios where you want to give them some advice or signpost them somewhere. They don't necessarily need an appointment, but it might be useful to flag it, or, if you've got concerns about such and such, please contact us. This message as well will also reflect whether they've completed the med review questionnaire. If they haven't, then the wording's a bit different, and we'll accommodate that accordingly. So last of all, please move medication review dates on, ideally to the last day of birth month. If you're a practice that uses issue numbers, that will be reflected here. Most of the time, we're clicking Do Now. The easiest way, as I understand it, is to select all. You can use this number 7. The advantage of this number 7 is that you can do up to 13 months, and you're not reauthorizing the medication. You're extending the review date. When you reauthorize the medication, you may know you lose the kind of compliance data that can be quite useful. Normally, we'd be saying to go to the end of the next birth month. And in normal times, if this wasn't a test patient, they'd have their annual review closer to their birth month, and so on. Given they've had their annual review in this QOF year, perhaps I'll set as far ahead as I can, which I think I can do that. Too far. Try that again. Actually, if I just put plus 1 year, that'll add a year to that date. No, that's 2 years. I really can't do my maths today. Sorry, bear with. Let's just go with that. Just to show you briefly in the journal, what this has done and our protocol has done is it's put together a bit of a consultation. So the patient's due for a med review, that the compliance has been checked, that they've done the questionnaire, that it's been carried out after they've attended their LTC review. If I were a GP, it would also code the fact that this med review was done by a GP or pharmacist or whatever my role was. And this should always reflect what's going on with the patient. So again, what we're trying to build here is a sort of safe, quick way to record med reviews that gives good documentation, but is nice and safe and doesn't take too long. Hope that helps. I think it's one of those things you'll get used to and you build confidence with the more you do. And let us know if any feedback or ideas or suggestions as ever. Thanks.